quick things. And now we would like to welcome our board chair of Connect Summit County, Natalie Herron.
Thank you so much, Betty, and thank you everyone for participating today. We appreciate that so very much. And I just want to welcome you to Summit County's first annual Utah State of Mind. My name is Natalie Herron, and I am, as Betty said, the board chair of Connect Summit County. Our mission is to create a well-informed, stigma-free community with access to mental health resources for everyone. Connect Summit County is a grassroots organization which began by struggling parents and citizens who found it difficult to find help for their loved ones who were deep in the throes of mental illness and literally did not know where to turn. I personally struggled with my daughter while she was in high school and was invited by someone involved with Connect to share my story of our family's struggles. I soon joined the cause of Connect to destigmatize mental illness, increase awareness of existing mental health services, and to build public support for increased spending on mental health in Summit County, all the while trying to find help for my daughter. I did not know within a few years we would be hit again and my oldest son would be diagnosed with bipolar. The last few years have been an indescribable roller coaster of emotion for all of us. I don't know what I would have done or where I would have turned without Connect Summit County. I had the ability to navigate because of Connect Summit County. I had the support because I was able to reach out to others who had the same lived experience. I knew which professionals to turn to for help. Most of all, our family and my son knew we were not alone. Over the years, Connect has brought together residents who are concerned about mental health issues facing our community. We are family members, loved ones, and friends of people struggling with mental illness. We are mental health service providers. We are people not directly affected by mental illness who generally are concerned and recognize the serious challenge facing our community. Over the next few days, we will be having honest discussions about the state of mental health in our community. We hope you'll tune in each of those daily. At this session, we will release the data that we collected in August of 2020 about access and attitudes towards mental health in Summit County. Thank you for being here and helping us to end stigma by normalizing the conversation of mental health. We want to thank the Park City Board of Realtors Philanthropic Foundation for sponsoring Utah State of Mind. Their generous support gives us the resources we need to make a big impact on mental health in our community in 2021. We will be hearing from Sarah Werbelow, President-elect of the Park City Board of Realtors Philanthropic Foundation, a little bit later in the program. We are so excited to have her here. Thank you again for joining us today. We hope you join us each day this week. We hope that you will share the information about the Utah State of Mind events with all of your circles. We are extremely proud to share this video montage and our findings with you. We hope you learn this week. We hope you take this information and it provokes some thought. Mostly, we hope that this week draws you one step closer to helping Summit County and our surrounding areas become that safe space that we also desire for those struggling with mental health issues, because like everyone else, that is what they and their families deserve. Thank you so much for being here.
There were moments where I felt like everyone would be better off if I wasn't here.
I know a lot of people, especially this day and age, are struggling with some form of mental illness.
It affects 20% of the population.
Reach out for help and know you're not alone.
2 years ago, I realized that I was dealing with postpartum depression, and I didn't know it. I just would start crying.
Our mission is to create a well-informed, stigma-free community with access to mental health resources for everyone.
Changes in my mental health
are just part of my nature.
And it's part of your nature too. Our ups and downs are absolutely necessary and okay.
Talking about mental illness is really hard. I want people to understand that this is a battle that we're all in together. Even though I'm in a better place now, I still struggle. It's okay not to be okay. It's who I am. This depression is a part of me. It's a part of my nature. Don't be afraid to speak up, because we can't lose anyone else.
Changes in my mental health are just part of my nature.
And it's part of yours too, and that's okay.
And it's okay to feel sad, because that's just something that happens. But if you always talk to someone, it can make you feel better because they can always help you.
If you're experiencing a mental health challenge, I'd say the best thing to do is don't be afraid to ask for help. It does not mean you're weak, and that's something I've struggled with. I've decided to own it and love it and love myself for who I am.
If you are ever depressed, you should always look up to a family member or a friend or a teacher.
Well, mental health is a part of our nature.
Please don't be afraid to get help, and know you are not alone.
Being able to talk about it, was a big thing. And if I'm advocating for our Latinx community, I feel it's important for me to come out and talk about it. There's a thing that we say in Spanish is, si tú no estás bien, no puedes estar bien para nadie más. If you're not good yourself as a parent, as a professional, there's no way that you can be your best for anyone else.
Aquí estoy para decirles cómo hago yo cuando me siento bien estresada o con mucha ansiedad.
Lo primero que hago es siempre hacer una lista de lo que tengo que hacer y basar esa lista en mis prioridades del día.
Podemos tomarnos unos pocos minutos o incluso unos pocos segundos para parar, estirarnos, tomar una mejor posición y poder respirar.
A mí me gusta hacer mucho ejercicio.
Y lo que yo he encontrado muy útil ha sido más que nada la meditación, porque me regresa al momento presente en donde mi mente no está tal vez futureando o no está pensando en algo de manera catastrófica, que generalmente eso es lo que me causa la ansiedad en primer lugar.
I know that these mental changes can be kind of difficult to cope with sometimes.
I deal with these changes by being productive.
By playing with my dog Cody.
By skiing and helping others.
I play some music. Ooh, what about you?
And we'd like to turn the floor now over to Deanna Rhodes, our Executive Director.
Good morning, everyone. Thank you so much for joining us. As you can see in that video, we have really taken a lot of time and energy and effort to really explore and try to explore from a data perspective. And so last year, as a board and staff, we underwent the rewriting of our strategic plan. And something that we really came to during that was that our vision is to make Summit County a mental health safe space. We envision a community where all residents, workers, and visitors feel welcomed, accepted, supported, and empowered. And one of the reasons that we actually felt like we wanted to do this survey is because we were early days of COVID, really probably even back in April and May, we started having conversations with some of our sister organizations in other Vail Resort communities through the Cats Amsterdam network. And those conversations was, wow, we are in this really, this moment together. And it's such a great time to really start talking about stigma and the fact that all of us, no matter where we're actually physically located, is that we really needed to kind of come together and come up with a campaign. And so Connect Summit County, we have been working on stigma since the inception of our organization. And it was so great to come together with other mountain communities and come up with a marketing campaign to address this. And so we were able to launch part of our nature campaign. So in the video, you probably heard a lot of how I connect to my nature, and that was all part of our campaign. But before we launched it, we really wanted to have a benchmark and know where we stood as it was. And so that's actually the catalyst for taking on all of this data. And we were able to successfully steward that community-wide anti-stigma campaign, part of our nature. So far, it's had incredible media and marketing results and impressive ROI, and we're really excited about it. But to talk about the data, which is why we're here today, through our strategic planning process, we identified that being a data-driven organization is one of our #1 strategic priorities. And collecting data is critical to the success of accomplishing our mission. To secure our position as a data-driven organization, we released the baseline survey to measure and better understand the attitudes surrounding emotional and psychological and social well-being in Summit County. And I'm jumping ahead just a touch, but we're really proud. This effort actually yielded over 1,000 completed surveys from our community in both English as well as responses in Spanish. And so we're really excited about that. Also just want to acknowledge a lot of our community partners are collecting data as well. And we are assisting in many of those efforts as well. We are assisting the Summit County Mental Wellness Alliance in collecting surveys for the mental health providers themselves, as well as we have been asked to advise with Park City Community Foundation on the COVID-19 impact and how we can collect data there. And then we're also re-engaging with the community impact survey that is through the Summit County Mental Wellness Alliance and the Summit County Health Department. And it's really exciting to be able to have this conversation and be a part of it. And so today, for the first time ever, we have been collecting and analyzing this data, and we're really proud to release it to you. And Rachel, if you don't mind to go to the next slide, just real quick. Something that was really telling, as we were in the middle of this, we found that, us as a community, we really believe that we have done incredible work on stigma. And we would say it's true. I mean, versus where we were 5 or 6 years ago, we have come a long way as a community. And, but when we launched this survey, it was in August. And it was right at the tail end of this experience with the Summit Community Clubhouse. The Summit County Clubhouse. And so in July, we really saw stigma play out in a way that was very concerning. And we have more information about this in our report, but to summarize it is that we had the Summit County Clubhouse is so fortunate because they have a new location. It's going to be over in the Highland Estates area. And because of that, they have to go in front of Planning Commission. And again, as a community, we really feel like we've really fought stigma and we've come a long way. But the public comments for this was really disheartening. And it made us illuminated how much work we still have to do. And I am going to read this one excerpt. Will the Snyderville Planning Commission guarantee that members are not current or former drug and or alcohol addicts, often associated with mental illness? And if so, how does the commission plan to monitor this representation? Would any of the committee members want such a facility adjacent to their house or in their residential neighborhood? What do committee members think will happen to the values of their homes in this neighborhood following such a move? Does the committee stand willing and able to withstand the liability, litigation, and potentially exorbitant settlement costs should something adverse occur? And for most of us in this meeting today, I think we're probably all very much on the same space, and we have a pretty good understanding of mental illness as well as mental health. And this just demonstrates to me that there is a lot of work to do. There is a stigma, there is a negative association with people living with mental illness, and so we're really happy that we're able to, get some quantitative information so that we can have a benchmark, so that in another couple of years, we can measure ourselves against this benchmark, as well as part of the entire Utah State of Mind event that we have planned for us today, or for this week, is taking other pieces of data that exist in the community. And I mentioned Connect Summit County undertaking our strategic plan for 2021 through 2023. And a big part of that is that we, again, in addition to being a data-driven organization, we also want to be incredibly transparent with this information. So it's great for us as an organization to pull this data and to be able to analyze it and make decisions based upon it. But also we want to be able to distribute it to all of our community partners so that they have the opportunity to make better decisions for the community as well. And that really is the power of collective impact and the journey that we're on. So with that, I will hand it over to Betty Morin, who is our data guru, if you will. She took this project on really maybe outside of her scope of work initially, but really took it on full on, and really proud of what she's been able to do for our organization. And so super excited actually to hear from her. And as she mentioned, there will be some Q&A at the end. So if you have any questions, you can go ahead and drop them in the chat as she's speaking, and we'll get to those at the end. So thank you so much.
Thank you, Deanna. I really appreciate that. My name is Betty Morin, and I would like to say a huge thank you to Deanna and to Natalie for the history and context behind both Connect Summit County and this specific project. I like to think of Connect Summit County as the bridge, conduit, link, if you will, between those seeking mental health services and those who provide them, like therapists, support groups, and the myriad of resources that we have available. Our peer navigators are just that. They are a peer. They are someone to help you navigate the ever-changing mental health resources in our community. When you contact Connect Summit County, we are here to listen, to match you with resources that best serve you. And with that in mind, like Deanna was saying, we're curious about stigma and the levels of it that stop people from making that first call to our peer navigators. Therefore, before we launched our community-wide survey, part of our nature, the anti-stigma campaign, in the summer of 2020, it was imperative for us to know and understand the landscape of our community about mental health before moving forward. We use the word stigma a lot, right? And it helped me to get a definition of that word. So I'd like to share that with you. Stigma, as defined by good old Google, is a mark of disgrace associated with particular circumstance, quality, or a person. And what our data shows is that we live in a community that is willing to help each other. But many of us are very hesitant to take the first step and ask for help. So let's go ahead and explore more of our findings of the Connect Summit County Mental Health Attitudes and Access Survey. So before we dive into our research objectives and our data and all of that good stuff, we are going to talk about our research methodology so that you have a good idea of where we were coming from as we created this survey. So Connect Summit County researched, curated, and launched a 14-question survey in English and Spanish to capture the two most represented ethnic, racial, and origin groups in Summit County, as reported by the U.S. Census Quick Facts in 2019. Our survey was distributed through community partnerships, email, social media, and flyers, with an eye for making the sample as random and county-wide as possible. We worked with a consultant to ensure accuracy of survey questions and high-level data analysis, such as statistical significance and correlation analysis. We would like to note that at Connect Summit County, we read probably and moderately as having hesitance. Therefore, in our results, we have placed those responses in the category of lacking information. So like I said before, we had the survey in 2 different languages. Excuse me. The survey written in English was active from July 22nd to August 7th, 2020. Like Deanna was saying, we had over 1,000 individual survey clicks with a survey completion rate of 80%. So that means that 849 of those 1,000 individuals completed the survey all the way through. And our survey response rate is unknown because the sampling was a broad distribution. We're not sure how many people saw the link and then chose to click on it. As an expression of our appreciation to those who completed the survey, respondents could opt in to enter a drawing for a gift certificate to a local Summit County business. And in our English survey respondents, 59% of respondents elected to enter this drawing. Our survey results in English are statistically significant at the rate of a 95% confidence level. Our survey that we released in Spanish had some slight variations, so I'd like to just share those with you. We used the same methodology as the English version. However, the translation added another layer. The Spanish version of the survey was translated by WeTranslate and then was reviewed by 2 Summit County community members. One is a native Spanish speaker who is from Mexico, and the other was a mental health service provider who speaks Spanish fluently. They offered edits to our translation, which we adopted before distribution. And we used this approach in order to ensure that our translation was not only accurate, but also conversational and accessible to our population. The survey in Spanish was active from July 29th to August 30th. We had 80 individual survey clicks, and our completion rate for this was 97%. And we'll go over the research objectives here in just a moment. And again, our survey response rate is unknown because our sampling was that broad distribution via community partnerships and social media and email blasts. So we're not entirely sure exactly how many people saw the link. I would like to note here that survey results are not typically considered statistically significant when a sample size is less than 130. And given the small reported population size of 1,904 people who in the Census Quick Facts 2019 represent as Latinx or Latino, the sampling methodology that we used, we believe that the results are still really informative, even if they're not statistically significant. We also realize that our population count is most likely very underrepresented. And in a number of conversations, what we've realized is that the guesstimate for the number of people who identify as Latino or Latinx or Hispanic, that is more around 20 to 25%. And that number comes from conversations with our Park City Community Foundation in 2020. So instead of the 11.5% that is represented in the US Census Quick Facts, we have a little bit of a discrepancy there. So we just wanted to share that. Again, as an expression of our appreciation, we did offer those who completed the survey to opt in for a drawing of a gift certificate to a local Summit County business, and 92% of the respondents to our survey written in Spanish opted in for that drawing. So now that you have some information about about what we've done, I would love to dive in now to our research objectives. So we had 3 research objectives for this project, and they were: do Summit County residents know about available mental health resources? How able and comfortable are Summit County residents accessing needed mental health resources? And do Summit County residents know about Connect Summit County? And our key findings are what I'm going to share with you next. And what these key findings are is they give an overview of our objectives and where respondents land in awareness and knowledge about mental health resources, ability to communicate about mental health issues, and familiarity about Connect Summit County. So for our first objective that you can read right there on the slide, what I'd like to highlight here is that resource awareness is the first step to resource knowledge and understanding where to access mental health resources. So finding out that 80% of our respondents to our English survey are not aware of mental health resources, that is a huge gap, right? And that 85% not only are not aware, but those respondents don't know where to access mental health resources in our community. And from our survey written in Spanish, we found very, very similar numbers, right? Where 84% of our respondents are not aware of mental health resources, and 91% of those respondents do not know where to go to access any mental health resources. So awareness of mental health resources is the first step, right? And then knowing where to access those resources is the second. So when marketing about awareness and where to access resources should be promoted in conjunction. So the way I like to think about this is that Connect Summit County offers a warm line, our peer navigation line, for resources in our county. And where can you learn about those resources? Well, we have 2 amazing peer navigators, and we offer this line in both Spanish and English. And we are going to go ahead and after I finish presenting, I will share that information with you in the chat. So then you will have the information about where you can call to access needed mental health resources. Our second objective on our next slide is how able and comfortable are Summit County residents accessing needed mental health resources? Well, in this portion of our survey, we asked questions regarding access and the ability to talk about mental health within our community. During this presentation, I'm going to specifically talk about our ability to talk about mental health in our community, and you can find some other findings in our full report about regarding access to mental health services. So what we found to me was really, really interesting, that 76% of our respondents are unlikely to ask for help for a mental health issue. That's in our survey written in English. Also in our survey written in English, 71% of respondents have helped someone with a mental health need. Wow. So folks are not really willing to ask for help, but they're willing to give help, which we also found in our findings in our survey written in Spanish as well, with 58% of respondents unlikely to ask for help and 53% of respondents who have helped someone with a mental health need. So while most respondents are unlikely to ask for help with a personal mental health challenge, the majority of survey respondents are not only willing, but have helped others with something to do with their mental health. What we see here is that there actually may be an opportunity to normalize and destigmatize mental health by reminding people of their loved one who struggled. How amazing is that? Our third objective might seem a little odd at the very beginning, right? Or maybe not that exciting. But the third objective around do Summit County residents know about Connect Summit County? Well, these findings were interesting, not necessarily because 84% of English survey respondents are unfamiliar and 91% of survey respondents to our Spanish speaking survey are unfamiliar, because we are a relatively new nonprofit in Summit County, Utah. But what was absolutely intriguing to me about this data is that we see that there is actually a correlation. And in this sort of small table on your screen, you'll be able to see that. But Connect Summit County is a significant resource of mental health information in our community. And what we found is that there actually is a correlation between knowledge about Connect Summit County as an organization and knowledge about access and resources for mental health. And because of this, we realized that we have an immense amount of work to get the name of Connect Summit County and what we provide in our community out in front of people as much as we possibly can, so that folks will know where to go in order to access needed mental health resources. The full report for this is available, and I will put it into the chat as a PDF file. And in this full report, you will also have access to our raw data, because we want to be as transparent as possible in this research. And so I'll be sharing that in the chat, and it will be emailed to you after this session. As Deanna was saying, in just a few minutes, you are going to have the opportunity to ask questions, to get curious, and to dive in more to these findings. Thank you so much for being here, because it shows to me that you are curious about our data findings, and that you may be just as passionate as I am about the data that we collected, analyzed, and are reporting on. Connect Summit County can't change stigma and our attitudes toward mental health without you. And I am personally grateful that you joined us today. And now I have the distinct pleasure of welcoming Sarah Warbelow. Sarah is a longtime community member and served as the president of Park City Board of Realtors in 2017. She is the incoming president for the Park City Board of Realtors philanthropic organization, which is the organization sponsoring this virtual mental health symposium. We can't thank them enough for their support. And welcome, Sarah. I have asked you to unmute.
Thank you so much, Betty. Can you hear me okay?
We can hear you, but we cannot see you, Sarah. Are we supposed to see you?
Well, I'm just having a little trouble on that end, so we'll just have to look at the logo.
That sounds absolutely perfect.
But thank you so much for just giving me just a quick opportunity to explain why we're delighted to be a sponsor of this event today. I am here as a member of the Park City Board of Realtors Philanthropic Foundation. So the Park City Board of Realtors Philanthropic Foundation is a 501c3. It's actually a separate entity from the Board of Realtors. It's the giving arm of the Board of Realtors. Prior to COVID, our mission has mostly been focused on awarding scholarships to both Summit and Wasatch County high school students. And this is a program we've been delighted to provide over the last few years. But as COVID came into our community and we've been faced with severe hardship and stress, we have found our organization in the position where we could expand our giving substantially. Due to the generous support of our members, our giving strategies have been able to broaden. We've been working closely with different community nonprofits to understand critical need priorities and have been able to partner up and focus on these needs. As our community continues to work through the pandemic and we learn how to navigate these troubling times, it has become clear to us that access to mental health resources are among these critical needs. And this affects us all in one way or another. Your words this morning have been very poignant and heartfelt. This can be a quiet need that sometimes is not apparent. We have had the good fortune of being introduced to Connect Summit County and have been delighted to participate as a sponsor of State of the Mind event to raise awareness for the tools and resources that Connect Summit County provides to our community. We very much value your mission and it resonates with us. The Park City Board of Realtors Philanthropic Foundation and its members are delighted to be able to participate in these conversations. We want to help raise awareness in as many possible avenues so that our community members can be led down healing pathways. Thank you for allowing us to join in this morning. We're here to offer our support of your efforts, and we are truly delighted to have the opportunity to partner with you so that we may assist in spreading the message of all Connect Summit has to offer our community. Thank you very much.
Thank you so much, Sarah. We really, really appreciate you and all the work that you are doing. And now, what we would like to do is we would like to share with you one more time our video montage that you saw earlier. Because given the data and information that you just heard, you might hear this information differently.
There were moments where I felt like everyone would be better off if I wasn't here.
I know a lot of people, especially in this day and age, are struggling with some form of mental illness.
It affects 20% of the population.
Reach out for help and know you're not alone.
2 years ago, I realized that I was dealing with postpartum depression, and I didn't know it. I just would start crying.
Our mission is to create a well-informed, stigma-free community with access to mental health resources for everyone.
Changes in my mental health
are just part of my nature.
It's part of your nature too. Our ups and downs are absolutely necessary and okay.
Talking about mental illness is really hard. I want people to understand that this is a battle that we're all in together. Even though I'm in a better place now, I still struggle. It's okay not to be okay. It's who I am. This depression is a part of me. It's a part of my nature. Don't be afraid to speak up, because we can't lose anyone else.
Changes in my mental health are just part of my nature.
And it's part of yours too. And that's okay.
And it's okay to feel sad, because that's just something that happens. But if you always talk to someone, it can make you feel better because they can always help you.
If you're experiencing a mental health challenge, I'd say the best thing to do is don't be afraid to ask for help. It does not mean you're weak, and that's something I struggled with. I've decided to own it and love it and love myself for who I am.
If you are ever depressed, you should always look up to a family member or a friend or a teacher.
Mental health is a part of our nature.
Please don't be afraid to get help and know you are not alone.
Being able to talk about it, was a big thing. And if I'm advocating for our Latinx community, I feel it's important for me to come out and talk about it. There's a thing that we say in Spanish is, si tú no estás bien, no puedes estar bien para nadie más. If you're not good yourself as a parent, as a professional, there's no way that you can be your best for anyone else.
Aquí estoy para decirles cómo hago yo cuando me siento bien estresada o con mucha ansiedad.
Lo primero que hago es siempre hacer una lista de lo que tengo que hacer y basar esa lista en mis prioridades del día.
Podemos tomarnos unos pocos minutos o incluso unos pocos segundos para parar, estirarnos, tomar una mejor posición y poder respirar.
A mí me gusta hacer mucho ejercicio.
Y lo que yo he encontrado muy útil ha sido más que nada la meditación, porque me regresa al momento presente en donde mi mente no está tal vez futureando o no está pensando en algo de manera catastrófica, que generalmente eso es lo que me causa la ansiedad en primer lugar.
I I know that these mental changes can be kind of difficult to cope with sometimes.
I deal with these changes by being productive.
By playing with my dog Cody.
By skiing and helping others.
I play some music. Ooh, what about you?
Thank you, Rachel, for playing that again. I did see one question show up in the chat, and Natalie, this is an excellent question, which is, in reading the comment that is in opposition to development that could affect providing mental health services nearby, is there anything in state legislature now that would support/restrict communities as development is proposed? And Natalie, I will be honest, I do not know right now. Deanna, do you have any sort of pulse on the Utah State Legislature? You usually do. So I thought maybe this could be a question that you could field.
Oops.
You're unmuted now.
Sorry. Yeah, so, I also, I don't know specifically about what's at the state legislature right now for this session. What I will tell you, though, is that, and if anyone was involved with the Summit County Clubhouse initially, that was actually part of the piece that was super heartbreaking, is that there was actually no code reason that the clubhouse can't exist where it was going. There was no legal piece of it at all. And it truly was just public opinion and the comments that were coming out. And so, I think, Natalie, that is an incredible question because in the state of Utah, especially from the state legislature, a lot of times it does cause extra hurdles there. And I think it's why this conversation is so critical. And some of the other conversations we're going to be having is we have to really be honest about where we're at so that we can prevent anything that might kind of come down the pike in the future. So in summary, I don't know specifically of anything that's happening right now, and I haven't really been concerned about that. It hasn't kind of come to our attention, but there are always maybe sneaky things that get popped in there. And from the Planning Commission for Summit County, in that area, there is no building code or stature that would have been negative to not allow the Summit Community Clubhouse to be there.
Thank you so much for that, Deanna. I really appreciate it. And while you, Deanna, were able to field that question, I did a quick Google search and I did find a website called legiscan.com/UT. It seems like a pretty interesting website, which talks about the 2021 general session and different bills that are coming up on the floor. So that could be a really great resource to even look at that on your own as well. I do see another question in the chat from Wendy O'Leary. She is our impact director here at Connect Summit County. And she has a really, really great question. And it says, is there a way to see if the respondents that know about Connect Summit County are in Park City versus other parts of Summit County? I wonder if we reach Park City more than other parts of the county. Wendy, that's a really, really great question. And because of the way that we structured the survey, yes, we certainly can do that. We did not go into that depth of analysis. However, we are able to go into that depth of analysis and look at where the folks who knew about Connect Summit County answered that they were from within the county. So thank you. That's a really, that's a great further level of detail that we can dive into. We have a question asking, will this be easily accessible on the Connect website as far as the video montage goes? And that is the plan, Lana. Well, we definitely will be sharing a blog post. It will be up on our YouTube channel as well. So yes, you will have access to that amazing video montage. And you are welcome for all of the great information. And Wendy's also sharing with us, also NAMI Utah's website has excellent information on the legislative updates. Thank you, Wendy. And anything related to mental health, and they make it really easy to understand. So that's another really, really great resource. I don't see too many other questions coming in on the chat, which makes me slightly happy because I feel like I kind of did my job then. Um, cool. Maddie has a great question. Since you are all well connected with providers, do they give you any feedback on how folks find them? So Maddie, I'm guessing that this is a question about, do providers share with Connect Summit County how people are finding them and getting them into their practice? I want to make sure I'm reading your question. Yes, okay, perfect, correctly. And Wendy, not to put you on the spot here, but I am not entirely 100% on that feedback chain. If I were to unmute you or ask you to unmute Wendy, would you mind speaking to that since you are our impact director? I'll give you 2 seconds.
I think that's a great question, and I'm scanning our provider survey because we do have a provider survey, and I don't believe that question is on it. There's a lot of questions on the provider survey, so we've got a lot of feedback from providers on the services they provide, on their wait times between appointments, on the time between contact and their first intake, how many get referred for med management. We have a lot of questions about providers, their hours, do they do telehealth, how people find them, or how they were referred. That's not on our provider survey, but I think that's an excellent question. I'm 99.9% sure it's not on there because I think I would remember, but I think that's an excellent question, Maddie. Maybe we should find out.
Yeah, that's awesome. And that's actually what's so cool about an event like this, right? Is that we have the opportunity to broaden our awareness and our looking, and actually, get live information and feedback from all of you. So I just am curious if there's maybe some not so fast fingers out there who are trying to write their questions out. So what I think we ought to do, as we maybe kind of hold space for more questions, is we would like to, excuse me, we would like to place in our chat, which I'm going to do, a link to our event feedback survey. We really, really appreciate knowing what it is, brought you to this event, what engaged you about this event, and how we can do better at events like this. So while you all might be thinking of questions, I've placed in the chat our survey link. If you would like to go in there, it'll take about maybe 60 to 90 seconds, depending on you. And we would just really love to get your feedback on this event. Especially since it seems like Deanna, Natalie, and Sarah, we did our jobs. We presented our information really, really well, which is pretty cool since this is new to myself, definitely. And it's been such a pleasure to put this together for the last few months. So since we seem to not be getting any more questions, Deanna, I would love to hand the floor back over to you to close out our conversation. That would be really awesome. And I'm gonna ask you to unmute because I did something funky that I've never done before. And so it made it weird for me too.
Excellent. Betty, I know you're going to catch this, but Kathy just asked to share the schedule with everyone in the chat, so I'm sure that you will do that. but yeah, I think, I'm curious again for anyone that wants to drop this in the chat. I'd be super interested to know what maybe one of the most interesting or maybe even surprising pieces of information that we share today. I hope that everyone gets an opportunity to look at the white paper. White papers can be a little bit dull, but we tried to really make it very easy to follow as far as reviewing the information. And as Betty mentioned, this is an opportunity for us to really learn and grow. So your questions are very, very welcome, because we may be wrestling around with them ourselves, or we just a blind spot that we didn't see at all, and we want to be able to be the driver of better information. Allows all of our organizations to make better decisions on what we do and how we move forward in this community. And a big part of Connect Summit County, as you can see in our logo, our tagline is the people's voice for mental health in Summit County. And I'm gonna probably throw a wrench here, but Wendy, you have made yourself available. So Wendy, I would love, if you don't mind, just maybe for a minute or two, just give a little perspective of how you expect to be using this data and what it means to you as far as being able to serve the people in the community in a better way. Betty, would you mind to put Wendy off, take Wendy off mute?
Okay, there we go. Yeah, so I think I didn't always love data. And I've been in mental health advocacy since 2007, doing lots of really good work. And data was always my least favorite part of tracking what I'm doing and outcomes, because I felt like that was not important. And as I've stepped back away from direct service, I'm starting to understand how important it is to really understand what we're doing and why we're doing it. And so with this data that we have here, this is attitudes towards mental health and accessing services. We have other things that we measure, of course, as an organization, but taking this information with our other data is going to really allow us to be much more effective and strategic, and really listening to the people. It's how we find out what's going on. How do our people in our community access mental health resources? Are they getting their needs met? Are there barriers? Are there gaps? As we have our peer navigators talking to people, and as we have events and we hear from people at events and talk to people, we're collecting this data in these community-wide surveys. And we put all that together and we find out what's really happening on the ground, so we can be the voice of the people. And then we can take this back to all of our great community partners that we have great relationships with providers and with other community partners who provide other types of support and resources in our community. And we can actually tell them, hey, here's what we're seeing and hearing. And then we can all work together to fill those gaps and to overcome those barriers. So that's why the data is super important. And then we can keep measuring how we're doing. Are we making a dent? Are we moving the needle? Are things improving in these areas where we're seeing there's a need? And so now Betty and I have both become pretty passionate about data, something that I never really saw the importance of, but now I really see how it can drive us and decide where we're going.
Well, thank you, Wendy. I think everyone listening can really get a sense of how passionate we have become over the past year about this. And I think in our space, it's really, really easy to be very emotional and very there's no shortage of great ideas of how we can serve the people of our community. But this data and being really rooted in where is the opportunity to make the biggest impact is what we're trying to achieve. And so just thank you so much, everyone, for participating in this conversation with us. We do hope that you will join us for some other conversations. Again, we're hoping to have some really honest discussions, and that can be challenging. Sometimes there's a little bit of a need to rumble, if you will, because if we already knew what to do, we would have done it already, right? And so we just really appreciate you joining us. Once again, I want to really just my deepest gratitude for the Park City Board of Realtors Philanthropic Foundation and Sarah Wearbelow for joining us today to really speak about what is so critical and why the Park City Board of Realtors and the Philanthropic Foundation feels that this is an important topic. And we're so grateful that they have really invested in us to help us do our work. And I also just want to acknowledge, there's a lot of realtors in town, and so just being able to spread that message and spread the word and make sure that more people in our community are familiar with resources, and the realtors have the opportunity to do that through their community as well as everyone else, that really helps connect, do the work that we're trying to do here. So if anyone is really moved by the work that we're doing. We do constantly have to fundraise, so we just want to give you the opportunity to donate. We would be very, very grateful. Any amount of money is really, we can put it to good use. And if someone, Rachel or Betty, could put that in the chat, I would appreciate it. And then also we don't want to leave anyone here without any resources. So this slide that has been put up is our navigation services. And this is, this is our peer navigators, our warm line, if you will. It is not 24 hours a day, and it is not crisis response. But what it is it is a person with lived experience who will walk you through and help you find resources in our community. They are very up to date. They participate in something called community mapping, which is just having a good idea of everything that's out there, and things change quite a bit. And Natalie, the board chair, early in this conversation talked about how she felt really alone as she was navigating, and this is a piece so that you're not by yourself. It is in English, and we also last fall were able to launch it in Spanish as well, a culturally competent line. And so please encourage people in your community to reach out if you need to. You can call or text, as well as there is an email address. And then we're really proud of this, and this is a community-wide resource, but the Mobile Crisis Outreach Team has come online, and that serves Summit and Wasatch County. And so that's really exciting, and that is crisis, but that is a new opportunity for our community. And that is actually something that we can be really grateful to the state legislature for passing and funding last year. So we just need to make sure we get it off the ground and people use it. So now you know it exists. And with that, I'll end 1 minute early. But again, thank you so much for joining us today. We are incredibly grateful, and we look forward to seeing you. The next event is at 2 p.m. today. So thank you so much, and hope to see you at the next session.